Welcome. I want to thank you for your time and your willingness to expand your knowledge. Our time today, although it is limited, it is potentially going to be very interesting. Today we are going to talk about a very interesting topic, which is tooth replacement options. Today, a lot of people have suffered from extracted teeth. Some other people have suffered from tooth removal due to severe decay, due to unrepairable tooth. They are seeking their dentist. They are seeking their dentist in order to replace the missing teeth. Replacing a missing tooth have a lot of options. Nowadays, a lot of options are available to replace a missing tooth. One of these options are the tooth implant or the root form implant, which is the most recent technique in replacing missing teeth. Teeth implants are, or root implants or whatever you call it, are root form screws made of titanium, which are inserted in our bone after drilling and are fused to bone over a time of around 4 to 6 months according to each case. After that, we load the implant and we load the crown above it. This is one of the tooth replacement options. Now we see in the video how tooth implants are drilled and how they are put in bone. Another option of tooth replacement is the bridges, dental bridges, which have been practiced for a long time. For around 60 to 70 years, we have been practicing dental bridges or whatever as a tooth replacement option. Actually, it's a very old technique, have been used by the Egyptians since 2000 or 3000 years ago, as have been recorded in some mummies. They found dental bridges made of gold, which was fixed to teeth by some sort of wires for replacing missing teeth, which, as I said, is a very old technique. Egyptians have been practicing it from 2000 or 3000 years ago. Nowadays, bridges have been modified. A lot of new materials have entered the field, like zirconium. These materials are done under a very precise techniques by using the CAD/CAM or the computer-aided design, computer-aided manufacture. CAD/CAM or computer-aided design, computer-aided manufacture is a new technique for manufacturing dental bridges. It depends on carving of the tooth or the bridge from a block made of zirconium by using a very sophisticated machine. The machine drills the bridge and fabricates it. The laboratory technician does not have any relation with the bridge. He just operates the machine, and when it finishes, he takes the bridge and gives it to the patient. If today we can make dental bridges in half an hour, in the old techniques, we should have to wait for around 4 or 5 days until the bridge go to the laboratory, and the laboratory technician fabricates the bridge, and then he sends it back to the dentist. But nowadays, with the recent techniques and with the recent machines, the bridges can be done only in half an hour session. The patient have a rest in the reception area until the machine drills the bridge and we deliver it to the patient. So dental bridges is an old technique, but now a lot of advances have been reported in the field, like zirconium, like porcelain fused to metal, like porcelain fused to gold. All these materials are now used to replace missing teeth. As a matter of fact, both are very good. We cannot say that dental bridges is not a good way, but the lifetime of a dental bridge is shorter than the lifetime of a dental implant. Moreover, dental bridge requires teeth reduction, while the implant does not require any teeth reduction. The dental bridge, in dental bridge fabrication, you have to reduce one tooth and another tooth and take impressions, and then you put the bridge on it. On the other hand, with the dental implants, you don't have to do that. All you have to do is drilling inside the bone, and then you put the implant alone without ever touching the adjacent teeth, which is a very good option for a lot of people. In order to know more about the procedures, dental implants usually require around 10 to 15 minutes of drilling inside the bone and another 10 minutes of inserting the implants. The whole procedure takes around 20 minutes. It's done under local anesthesia. We don't need to use general anesthesia. In the past, some people were scared of this. They say, I'm going to do surgery, I'm going to wait for a lot of time. But nowadays, it's not done like this. It's done only in a single visit. In the same visit, you put the implant, even without surgical opening of the gums, as in the past they used to open the gums. and then they drill the implant. Nowadays, you put the implant immediately without drilling or even without touching the gums. You put the implant immediately without even touching the gums or opening inside. Moreover, dental implants are favorable than bridges. They live longer, they last longer, they are easy to take care of, they stimulate the bone, they stimulate the jaw bone, they help keep our bone healthy, they help to prevent bone resorption. While dental bridges doesn't have all these benefits, as they are fixed on the teeth, they cannot help to keep bone healthy, they cannot help to protect the adjacent teeth or protect the alveolar bone. Dental implants lifetime is around 20 years. Some dental implants have recorded to live for 25 and 30 years. Some people have made implants and have for more than 40 years. But the lifetime is around 20 years. Lifetime of dental bridges is around 30 years. Lifetime of dental bridges is around 12 years to 14 years if it is done using the if it is done using good techniques and good materials. So dental bridges is a good way to replace teeth, but implant is a more favorable way to replace missing teeth. After putting an implant, there are certain instructions the patient should follow. First of all, the patient should avoid eating and drinking for around 2 to 3 hours after the implant procedure. He should avoid eating on the operated site for around 2 days. If there are stitches or sutures, it should be removed after 1 week. As we said, with the new techniques, we don't need to use sutures. We just drill the implant inside the bone. Moreover, the patient should take care of the treated site, not to brush over it for the first few days. He could brush his teeth on the other side. Dental implants, as we know, is very efficient. After that, the patient resumes his life very normally. There are no any concerns with dental implants. After 6 months, the implant is left. The implant is left in bone for around 6 months in order to allow for something called osseointegration. Osseointegration is a fusion between the bone and the dental implant. It takes around 6 months to occur. Once it has occurred, the implant becomes very strong. Then we can load it with the crown. We put the crown on the implant by using some sort of connections with some sort of screws, and it becomes a separate tooth that the patient can eat on, and he enjoys eating on it for around 20 years. Dental bridges, on the other hand, have some also instructions after doing a dental bridge. It takes around 2 sessions. The first session, the dentist is going to reduce your teeth, or is going to make them smaller, and he takes impressions. After he takes the impressions, he sends it to the laboratory. The laboratory fabricates the teeth, as we said, either by using the porcelain fused to metal or by using the zirconium. It depends on the patient's desire, and it depends on the case. Then he sends us back the bridge. Then the bridge is cemented on the reduced teeth. During the period of 1 week, the patient walks to the temporary bridge or a temporary restoration. The patient is not supposed to eat on this bridge. The patient is not supposed to drink cold drinks if the pulp is vital. The patient should avoid any sticky or hard foods in order to avoid removing the bridge. After a period of 1 week, the dental bridge is now ready to be cemented on the teeth. After cementation, the patient can enjoy his life and eat on it. But should be cemented for a period of 6 months with a temporary cementation in order to check the condition of the bulb, if there are any problems with the bulb, if there are any inflammation happen, because when we reduce the teeth or work in it, some sort of inflammation might happen to the bulb. So we should be very keen and be very familiar with these things. If the bulb is inflamed, we can remove the temporary cementation and fix the bulb by a very simple procedure, and then cement the teeth again, and then cement the bridge again. So we have seen the difference between dental implants and the difference between dental implants and dental bridges. As a matter of fact, we recommend dental implants as a teeth replacement option, as they are very effective, easy to take care of, stimulate the jawbone. Dental bridges also is a very good way to replace teeth or missing teeth, but we don't recommend it now only for special cases that cannot do implants. To know more who cannot and who can do dental implants, some diseases affect the bone, so it makes some limitation in case of dental implants. One of these diseases is diabetes. Diabetes is a common disease affecting many people. It affects the blood sugar level. Often people suffer from increased sugar level in the blood. This disease actually affects bone also, affects the healing procedure. So dental implants should be done with care in case of people suffering from diabetes, as there are some problems with the healing. The patient should have a controlled sugar level in the blood. He should make some tests before doing the implants. Also, before doing the implant, we should take some x-rays. Sometimes we take a cone beam or a 3D x-ray. This x-ray film is done in 3 dimensions. It gives us an idea about the bone level, the bone width, the bone height. All this is very important during the drilling procedure. As if the bone is short or the bone is thin, we will not be able to drill inside the bone. So the patient should take the x-rays. The patient should have a complete medical checkup, should have a complete medical history. If he's suffering from hypertension, diabetes, that should be reported. If he's suffering from heart disease, if he's suffering from any other problem, should be reported, as all these affect oral health and should be done carefully. The patient should be careful when he is targeting a dental implant procedure. He should do the complete dental checkup, complete medical checkup, and do the required x-rays. As we said, implant is a very simple procedure. It takes no time, but you have to wait for 6 months in order to get the tooth, which is the period during which the tooth is going to be fused to the bone, while the bridges is done only in 1 week on 2 sessions, as we explained. But still, we recommend dental implants as they never touch the adjacent teeth. On the other hand, when you do a bridge, you have to reduce a tooth and reduce another tooth and cement the bridge on it. So dental implants are more favored than dental bridges. Thank you.